Okay, so we are live now. Hello, everyone. I'm Dr. Sagrika, Ayurveda consultant, and I'm the moderator of this live. And today's live is with Dr. Swati. Let me introduce Dr. Swati first. Dr. Swati has done MD in Rasastra and Bhaisaj Kalpana, and is a public figure in the field of Ayurveda and holistic wellness. Dr. Swati has been an integral part of Purely Yours since its inception, research and new product development from the brand. With a firm belief in the transformative power of Ayurveda, she advocates for its widespread adoption as a means of elevating the healthcare burden in the country. Driven by her passion for exploration and discovery, Dr. Swati is a prolific researcher with a portfolio that boasts over 10 papers published in prestigious national and international journals. Her expertise has recognized on a global scale, leading to invitations as a guest speaker and panelist at uh, esteemed forums, including the prestigious Cannabis Asia 2022 in Bangkok, Thailand. As a visionary leader and advocate for holistic wellness, Dr. Swati continues to inspire and educate audience worldwide on the profound benefit of Ayurveda, shaping the future of healthcare through her innovative research and unwavering dedication to promoting well-being for all. Hello, Dr. Swati. Today's live is on menstrual wellness. So, I guess it will a very knowledgeable session to all of the women out here. And let's start the session. Next voice is your Dr. Swati.
Yeah. Thank you, Dr. Sagrika. Thank you for your kind introduction. So, as we were discussing today, the topic is about menstrual wellness. So, we are saying that pain to power. Generally, what happens is why we came to this topic was that menstrual issues are something which most of the women face. A staggering 80% of the women have menstrual issues, but none of that gets discussed. Most of them don't understand what exactly menstruation is, what exactly is bleeding phase, what are the phases of menstrual cycle. Majority of them don't understand, and at what phases what can be the problem. That is also not mostly understood. So what happens is they don't understand the difference between what is normal and what is not normal, what needs medical attention. So, I thought that we can, have a discussion about this as to what exactly is normal menstrual cycle, and then where all it can go wrong, what are the issues we can see with irregular menses, and what are the basic changes in lifestyle, diet, and what are the herbs that can be used there. So that's how the session will be progressing also. We'll first discuss as to what exactly is normal menstrual cycles, and then we'll go into what can be the issues in which phases, and then how to manage it with dietary lifestyle modifications and all. And then as a brand, Purely Yours offers a lot of solutions for these menstrual issues. So next I'll deal with those things. um, as we proceed, you can see that here there's a small basic flow chart, a basic diagrammatic representation of what happens during a menstrual cycle. So menstrual cycle is a complete 28-day cycle. 28 to 30-day cycle is what it is in women, where initially first 5 to 6 days is the bleeding phase, followed by we have proliferation phase, and then ovulation and secretory phase. So what happens is, to explain it in a very simpler term, uterus prepares itself for conception every time a ovum is released from the ovary. So ovary releases the ovum into the uterine cavity, and uterus starts preparing itself to imbibe that ovum if it gets fertilized. And when that doesn't happen, the thick layering of the endometrium that is proliferated because of having to accommodate the fertilized egg breaks down, and that is shredded in the form of menstrual blood. And then once the bleeding phase is over, again slowly the proliferation phase starts. That is, again the uterus starts preparing itself next month for the ovulation and conception, which might happen sequentially. So if conception happens, then what happens is the hormonal cycles change, and that fertilized egg gets implanted into the endometrium. So this thickening layer you can see here, this is endometrium. So it gets implanted here, and then it starts growing inside, and then that in turn becomes placenta. So that is how pregnancy happens. So this is the basic understanding of menstrual periods. So if we see here, so if we see this diagram, you can see that there are three things we are representing here. One is the hormonal changes, second one is the ovarian cycle, and then what happens with the endometrial layer. So endometrial layer is inside the uterus, directly responsible for the bleeding. So that is something we covered. The second, ovarian cycle, is there are a lot of immature ova that are inside the ovaries. So as soon as different stages of menstrual cycles approach, these one of these ova mature and become ovum, and then it kind of, it breaks out from its from the ovary and then moves into the uterus. So that is the phase that is happening in the ovarian cycle. And then if you see the hormonal cycle, that's something which is very important. You can see that there is estrogen, there is follicle stimulating hormone, luteinizing hormone, and then progesterone. So you can see the variation of these hormones in the graphic representation throughout the 28-day cycle. It is never same, it is never in the even level. So there's always a low and then high, and then back again low, and then it goes high, and then it goes down. And then at one phase there's one hormone that is acting excessively, in another phase there's another hormone that's acting excessively. You can see there are multiple peaks at multiple times. So all of this indicates that for a non-technical person, it's important to understand that there is a lot of variation going on in the hormonal aspect also for women. So there are three areas where things can go wrong in menstrual cycle. So either it can go wrong at the hormonal level, either it can go wrong at the ovarian cycle, that is the hormones are being okay but the ovaries are not, performing properly, because of which there's no mature ova, that can be anovulatory cycles what we call, because of which the patient might not be able to conceive in future. And then there is endometrial issues, like, inflammation of the endometrial layer, which we call endometriosis, or presence of endometrial layer in other parts of the body, like sometimes it is there in intestines and all, because of which the bleeding happens through anal region, and then there's extreme pain and all that. So all the three places there can be a lot of issues when it comes to menstrual cycles. So now, if we speak about what can be the causes for these disruptions, so we saw that there's hormonal, we saw that there's ovarian, and then we saw that there's endometrial. So all three things, what are the main disruptors for these things? So because we have to be sure that these things, there's something in this that is getting disrupted, because of which we are seeing irregularities in the menstruation. So, what are the things that are getting disrupted? What are the causes for this disruption? So, if we talk about adolescents, that is women who have just attained puberty, who have just attained menarche, and who have just started menstruating, and in the reproductive age, that is generally on an average, we take reproductive age somewhere between 24 to 34, where women plan for conception and all that. So these are the two categories of women in their active phases. So what are the main reasons for disruption of menstrual cycles? If we can see here, the first and foremost, both the places, it shows that mental stress and then weight loss, bad food habits, pretty common. And one of the very important things that we see here is excessive exercise. Ati Vyayama is something which Ayurveda has been very particular and very vocal about. So, Ayurveda believes in exercising, but it says that exercise has to be up to one's capacity, half of one's capacity, not over exercising, because Ati Vyayama again leads to Vata Prakopa, and a lot of issues that surround them include dysmenorrhea as well, which leads to severe pain during periods and irregular bleeding and clotting as well. So that is one thing we have to see. And if we give a modern logic to this as to why excessive exercise can lead to delayed periods, if you see the previous slide where I was speaking about the estrogen cycle here, if you can see estrogen is in pink, by excessive exercising, this estrogen level goes down. And because the estrogen level goes down and testosterone levels increase, there is masculinity that increases in women, because of which it leads to amenorrhea or absence of periods. So that is very important, and it's very important for everyone to understand that exercising is important, but exercising to certain extent only, not over exercising. And then bad food habits, of course, all of us know. Lot of junk eating, lot of food, especially the maida predominant food, which are heavy for digestion, which because of which has high glycemic index as well, because of which the blood sugar levels can rise, and that leads to irritation and inflammation in the tissues, and also that leads to insulin cycle issues and insulin resistance in the cells, because of which it can lead to PCOS as well, PCOS, polycystic ovarian disease. And then they say that weight loss as well as overweight. So you can see there are two opposite ends of spectrum. This weight loss, extreme weight loss, can also lead to menstrual irregularities, and weight gain, extreme weight gain, can also lead to menstrual irregularities. And one more common thing is use of hormonal pills. The hormonal pills that we use in terms of oral contraceptives, which are known as oral contraceptives, or probably IUDs also to a great extent, or even the next generation contraceptive patches and all those can mess up with your hormonal cycles. They can mess up extremely with your hormonal cycles. So it's always better, especially in the women in reproductive age where they're using contraception. It's always better to use contraception, which are mostly physical contraceptions, rather than going for hormonal contraception, because that can ruin the health, and eventually these hormonal pills themselves can be a primary cause for infertility in women at later stages. When they actually want to conceive and they stop taking these hormonal pills, they start withdrawing hormonal pills, then they realize that it was too much, because of which they're facing infertility issues now. So it's always recommended to use mechanical protection rather than going for hormonal or chemical protection in women. So we were discussing that there are a lot of lifestyle issues, there are a lot of stress factors that's contributing, over exercising, under exercising, gaining a lot of weight, losing a lot of weight. But what does symptoms of irregular menstrual cycles look like? Like, how do you say you're having some irregularities in the menstrual cycles? Some of the main symptoms you can identify are periods that occur fewer than 21 days or more than 35 days. Like when we were seeing the first part, we could see that it was between 28 to 30 days. That's the average. But still, we take a plus or minus 6 day count over there. And in despite that, if the period is happening after 35 days or within 21 days, then that's a sign that there is some irregularity inside. Missing 3 or more periods in a row, menstrual bleeding that's very heavier or lighter than usual. Your normal is like average 1 or 2 pads or 2 to 3 pads in the initial 2 3 days of menstrual cycles, followed by 1 pad a day at later stages. But if that gets heavier, that is you switch to like 5 or 6 pads a day and all that, or if it gets lighter as well, that is the flow literally stops, for it happens for only 1 day and then stops, or it's happening for 2 day and then stops, then also it is alarming. Periods that last longer than 7 days, that is the bleeding that lasts for more than 7 days. Average, the general duration is between 3 to 7 days, but anything under 3 days and beyond 7 days is considered to be abnormal. And then menstrual cycles shorter than 24 days, 38 days again. So we consider 35 or 31 days, with 38 days depending on the bleeding phase. And then menstrual cycle that changes by more than 20 days each month. For example, your bleeding is happening somewhere around 5th to 7th March of this month, but next month it gets pushed by around 20 days. That is, you have your cycles somewhere around 20th April, 23rd April, or 25th April, and then that gets pushed again in the next cycle. That is a sign that there's some irregularity happening in your menstrual cycles. And then, of course, heavy bleeding, and then menstrual cramps. Menstrual cramps is something which is very normal, and people assume that it's something they have to live with because it's a very natural process. So, women have to go through pain, women have to bear the cramps, but it's not true. Uh, a mild cramping for around 20-30 minutes in the first 2 days of menstrual cycle is very normal, because there's bleeding happening, uterus is shredding a layer. So because of that, there'll be a very mild discomfort like cramp. But when the cramp is severe enough that it's disrupting your day-to-day activity, it's making you want to actually lean forward rather than sit straight, and then it's making you want to rest and not being able to walk from a distance A to B, or you're feeling nauseous along with cramps and all, then it's high time you understand that there's some irregularity in the menstrual cycle and you need to get it addressed. So now that we have discussed what are the symptoms of these things, next let's look into what are the main changes that have to be done when it comes to improving your irregularities. So do you directly need to go and see a doctor, or can you implement certain changes in your lifestyle which can actually help you? If we look into it, Ayurveda is very, very vocal about two things when it comes to chikitsa. The first line of treatment for any form of chikitsa, Ayurveda says that is nidana parivarjana, that is avoiding the causative factors. So that is the primary aim of the treatment. Like, first thing, if you have to get well, if you have to get relief from the health condition, diseased condition that you are in, the first and the foremost thing you have to do is remove the cause from your lifestyle, from your diet, from your day to day routine, everything. So, that is the first and foremost thing that we need to do, and that includes dietary modifications as well as lifestyle modifications. So, anything related to menstrual irregularities is mostly because of our erratic lifestyle and dietary habits. And by reversing that, by having a proper diet and by having lifestyle, by introducing certain lifestyle modifications, it's very easy to curb these issues on their own, instead of going to a doctor and again getting a hormonal supplement just because your system is not working fine. And the next best option would be herbal supplements. So, as a doctor, you can ask me, is it something you advise on a day-to-day basis that I should start taking it? No, unless and until you're seeing some problems, unless and until you're seeing any of the previous symptoms that were discussed about, you don't have to take herbal supplements as such. But yes, if you're seeing those symptoms, then it's better to start taking herbal supplements also. So now if we discuss about dietary modifications, what are the primary dietary modifications that can help us in dealing with menstrual cycle irregularities? Some of the simplest changes that we can do is reduce or limit the consumption of dairy in our diet. That is, it can include milk products like paneer, cheese, all of those. Reduce the consumption. You might not stop it completely, you don't have to unless you are diagnosed with a polycystic ovarian disease, but reduce the consumption and keep it in a moderate level, that is not too extra or not too low, because majority of the women, in an effort to have a protein rich diet, go for a lot of paneer consumption that can actually aggravate the hormonal issues in them. So it's very important to limit, because moderation is the key. Whenever, if you have spoken to an Ayurveda doctor, or if you have been through some Ayurveda treatments, you would clearly understand that we don't restrict you from having anything, but what we say is it should be had in moderations. That is very important, because anything, if you stop completely also, that can be harmful, and at the same time if you overdo it also, it can be harmful. And one more simple dietary modification that can be done is reducing crash diets. So everyone has this urge to go on a fat diet to lose weight, fat diet to feel healthy, fat diet to detox, but it's very important to understand it has to happen in a very systematic manner. So you don't go out there and just think, I'm doing intermittent fasting today and I'm just detoxing, and then you stop eating for one entire day, and next day you end up eating twice the amount you had, twice the amount of the food you normally have. That puts your system to a toss, and then that leads to a lot of hormonal imbalances. So it's very important to understand, even if you're reducing the food that you are eating, it has to still suffice your appetite. You should not cut down your appetite. Even when you are hungry, you should eat that it's sufficient for your system, and at the same time give food when your system asks for it. Don't consciously avoid eating just because you have to achieve a particular weight target, because that can lead to vata prakopa, and again that leads to a lot of hormonal imbalances and menstrual irregularities again. And then next comes is lifestyle modifications. When we speak about lifestyle modifications, we talk a lot about being active, having a active lifestyle, working out consciously, and all that. But amongst all these, we forget one of the very important factors: being mindful. Being mindful, understanding your own body. uh, Many people have told me, many of my patients tell me meditation karna mushkil hai. You suggest them to meditate for like 5 minutes, they'll be like, nahi ho pata hai humse, it's very hard to shut down, it's very hard. The simplest way to meditate is getting to know yourself well, getting to know your body well, and being mindful of what your body is asking for. Just sit for a second, sit for a minute, and see how your body feels. You know, just sit. Are you feeling lightheaded? Are you feeling pain somewhere? Are you feeling a little discomfort somewhere? You know, probably some joint might cause a crackling sound. So just observe your body. Just be mindful of what your body is. And that's a very important practice, because by being mindful about what your body is and what it wants, you're giving it what it exactly requires, and that helps in healing the body very well. And along with that, yes, include exercise in the routine, and again, moderation is the key. One of the simplest factors to understand, because the seasonal variation, because Ayurveda says that in winters you have to exercise more almost every day, whereas when it comes to summer, you have to switch to exercising twice or thrice in a week. So according to seasons, according to what your body needs, there's a lot that is going on when it comes to exercise. We can have a separate session on vyayama at some stage in the future. But just for you to limit yourself or restrict yourself and understand when you have to stop, it's simple. Ayurveda says that ardha shaktiya vyayama is very important. So how do you understand what is ardha shaktiya? How do you understand what is that particular capacity of your own? So it's simple. When you start sweating profusely, your foreheads are sweating, your armpits are wet with sweat, that's when, and your breathing picks up, you start breathing heavily, that's when you have to stop exercising. That is your limit, and you can't go further. Once you start going beyond that, that is when you start accumulating a lot of health issues. And that is what we mean when we say over exercise can also lead to health issues, especially menstrual issues. Now let's come to herbal supplements. So when I'm speaking about herbal supplements, there are a lot of things in market. There are a lot of things you can do around. You can work around and all that. You can prepare at your own homes. You can keep certain herbs handy and do that. But it's always important to understand that the quality of the herb has to be very good, because one of the biggest challenges as Ayurveda industry we are facing today is the quality of herbs. When we discuss about the herbal medicines, when we discuss about the herbal supplements, the biggest problem is identification, adulteration, as well as the efficacy of these herbs. Because some of the herbs are identified wrongly, some of the herbs are adulterated because of less availability to just ensure the bulk supply, and then ultimately all of this kind of leads to compromise in the efficacy. So it's very important we use products which are efficacious, which are not adulterated, and which can deliver 100%. So that's where purely yours comes into picture, because we provide products which are natural, which are 100% organic. So there's no pesticide contamination, there's no heavy metal contamination. You can actually see the reports for yourself. When you put the batch test report of the product, you can see the reports for yourself as to what is the exact quantity of pesticides or anything of that sort that goes into it. So you can be sure that this product is safe and effective at the same time. So, what are the products we are offering, and what are the products you can try to regulate your menstrual cycles and which can help with your optimum fertility and all that? So, if you can see, we have proprietary capsules as well as proprietary herbal tea. So, our proprietary herbal tea is called Organic Overcome Tea, which is one of the teas we are very, very proud of bringing out, because this we have seen a lot of very good results. We have heard very good reviews about it. This works very effectively with menstrual cramps. So this works as an emergency management in menstrual cramps, and considering the kind of stigma around menstrual spas right now, and the toxic effects it can cause in, eventually over a period of time, or the adverse drug reactions that it can actually cause. And considering government being skeptical about use of meftalspas and planning the withdrawal of meftalspas as a medicine, it's very important to understand that we need healthier options, we need healthier alternatives to manage menstrual cramps. And this is one such healthier alternative. This can be a very immediate answer for your menstrual cramps. One cup of this tea can relieve menstrual cramps in around 25 to 30 minutes. And then this can be consumed on a day to day basis. If you feel that there's any hormonal issue you're going through, this can be your day to day supplementation, and that can help you regulate your hormonal issues. And then we have Femverve capsules, which is made up of shatavari, gokshura, and methi, which generally help in enhancing the ovulation, which helps in addressing the ovulatory issues, and also which helps in improving the ovulation and thus can help you with the fertility eventually. And then we have Floweda capsules, which actually handles the uterine muscles and the endometrial layer, because of which, if there is any issue in terms of endometrial thickening or endometrial problems, infection in the endometriosis, Floweda makes sure that that is regulated, that is addressed, and because of which your period flow is optimized. That is, if you are having a lesser flow, it improves the flow, and if it is more flow, then it helps in curbing the flow. And then, of course, we have fembalance capsules, which are useful for maintaining the vaginal pH, reducing the vaginal infections, and also reducing the abnormal vaginal discharge along with foul smell and all. So these are some of the products that can actually help you to cater to your needs of irregular periods and all that, and balancing your own hormonal systems at the same time without any side effects, and also very effective because we're using organic ingredients. So, with this, I would just like to throw some light on PCOS study, one which was done using our own products. We did a small case study where we used Femverve on a patient with polycystic ovarian syndrome, and the results were very good. And the cysts resolved within 3 months, and patient was in fact, over the follow-up period, patient was also able to conceive. So that's the kind of efficacy these products have. That's it from my end today. Thank you so much for being patient listeners.
It was very, very nice and knowledgeable session by Dr. Swati. Thanks for sharing this knowledge, and hopefully हम आते रहेंगे live और new topics पे. And today's live is on menstrual wellness. I guess everybody is clear now on our part, and thank you for the session and your time, ma'am.
Thank you. Thank you so much, doctor. Thank you for having me.
Our pleasure. Okay, ma'am.